Hi, Tato. Would you please kick us off the health equity session? Thank you.
So, Kyle, there was a big echo. I lost a lot of what you said.
Could you please just start us off with the reproductive health equity session? If you could just introduce everybody and take it away for us. Thank you.
Okay, great. I think we're missing Solange, so we'll just continue without her. Okay, great. So good morning, good afternoon, and good evening to you all. My name is Tato, and I'll be your facilitator for the next 40 minutes. So we've spent quite a substantial amount of time just looking through global health equity in the context of vaccines and disease. So we're now going to shift gears and view equity from the lens of reproductive health. So just to provide a high-level update, in its reproductive health strategy, the World Health Organization actually noted that despite its ambitious goals to reduce maternal mortality deaths, perinatal morbidity, reproductive tract infections, and sexually transmitted infections, including HIV, unwanted pregnancies, and unsafe abortions, a challenge that remains for many countries is to formulate as well as implement innovative national strategies for making reproductive health services accessible to the people in greatest need. And so I'm excited to think through what reproductive health equity looks like with an amazing group of panelists, Bonita, Blandine, and Solange, who I hope will join us shortly. And so at this juncture, I'd just like to call upon our panelists to introduce themselves. And please just tell us a little bit about what you do and where you're based. And I think we can kick off with Bonita.
Thank you so much, Tato. My name is Bonita Beatrice Nanzidi. I am based in Uganda. And professionally, I'm a software engineer with a specific bias towards digital health. I am a patented innovator with a registered patent in the US and in Uganda for a smartphone-based sickle cell diagnostic tool. And alongside the sickle cell diagnostic tool, I'm also working on a telehealth platform called MedAtlas, whereby we are making it very easy for people to access fertility experts. Like it doesn't matter where you are, you can be able to book a slot online to be able to see a fertility specialist, and then after you can work out ways towards which you can be able to get solutions like IVF without having to leave your country. Thank you so much.
Thanks, Bonita. Welcome, Solange. We'll have Blandine and then Solange introduce themselves. Blandine, you're on mute. If you could just unmute yourself.
Sorry, I'm Blandine Muziranenge. I'm from Rwanda. I'm the founder and CEO of Cosmotive. It's a social enterprise that uses both digital technologies and textile technologies to improve reproductive health and maternal health. So far we have been using storytelling to increase access to this reproductive and maternal health information, and also we make the products that are needed for self-care for women. Thank you.
And last but not least, Solange.
Hi everyone. I'm sorry, I'm having difficulties with the internet. We just had a terrible wind which affected the connectivity, so I'm sorry. My name is Solange Imana, and I'm the co-founder and executive director of Generation Rights, which is a community-based organization that works to empower young girls and help them to develop self-confidence and acquire other necessary skills for them to flourish and pursue higher education. We are based in rural, and we work with under-resourced schools in rural to engage both school leaders, parents, and girls themselves to really empower them and achieve higher education.
Great. Thank you so much for those introductions. And I think at this point, we'll just take a deep dive into the questions. And so the first question that I'd like to address to all of you, and I think you can just decide whether or not you'd like to respond to it first, is on the concept of reproductive health equity and its importance. So in this era, what is the significance of achieving reproductive health equity? Over. Would anyone like to take a first stab at that question?
Okay, I'll take the first step. So that I feel, according to me, the significance of achieving reproductive health equity is, for example, I'm currently working on a project. It's called MES. Basically, is increase access to fertility.
Okay, I think we've lost Bonita. While she reconnects, Solange, would you like to just share your initial thoughts on what you think the importance of achieving reproductive health equity in this era is?
Yeah, sure. I think it's really important because when I'm reflecting on that question, when we look at for example, SDG number 3, we are all, as a country or as a global level, we are all aiming to achieve quality health and well-being, and that's the big role. And that's the big goal that we want to achieve. And I think making sure that we have, we address inequalities that is still existing in a reproductive health is critical towards to achieve that goal. And also looking at the current situation of COVID-19, I think we all want to be able to take care of ourselves and be at a better position for making sure that we are, for example, we get vaccines, or we are even capable to address the effect of COVID-19, which includes the issues that are related to reproductive health. And if I may share, in our case, when I work with young girls who come in rural, one of the biggest challenges they are facing is lack of access information in relation to sexual reproductive health and rights. So to me, making sure that we address the inequalities is really critical, as we all want to have a health society globally, not only locally. So to me, it's very, very, very critical.
Blandine, any initial thoughts?
Thank you. I will not go far from what Solange said. I think it's all about all of us being having enough access, or even affording to know and have the like services that are related to reproductive health. And with this, what we get, like what most of us are facing is most rural areas and other young girls, adolescent girls, they don't have enough access on this, like all the information they need to know about their reproductive health. And there's a lot of issues coming after the lack of knowledge. And sometimes it's not only about like having the infrastructure there, like hospitals are there, all this clinic is here, they are they are offering this service, because there are those girls who don't even know about the service, who don't even know for my productive health I need to know this, for my like the change in my body I need to know this. So I think mostly having like enough access, like increasing access in all the ways about the information about their reproductive health and all about our bodies is critical, and also increasing access to these services that they need after knowing about your body, after having all the information about your reproductive health. Sometimes you need other services. So for me, I feel like it starts with having information, creating enough awareness about it.
Thank you, Blandine. We lost you a little bit towards the end, but I think that both you and Solange mentioned really key issues which really speak to the importance of ensuring that people in rural areas also equally have access to reproductive health services. And so I'm going to shoot my next question specifically to Solange, who is doing quite a lot of grassroots work. And the question I'd like to ask you is, so what is the role of grassroots organizations in advancing reproductive health equity?
Yeah, thank you so much for that that question. And I think as one of the community-based organization, I think one of the biggest role is to make sure that we bring the information down closer to the people that we serve. Particularly when we look at the current situation, it showed that there is a huge gap in access to information among people that live in urban or in rural or semi-urban. And I think this is very important to us to make sure that we bridge that gap. So as a grassroots organization, we are at better position to know which kind of information that is missing in community. How can we get that information to the people that really need to have that access? So I would really say that that's one of the key roles as community-based organization, and also looking at the effect of the current situation, because we are going towards the digital world. We are, now working online, needing internet connectivity, needing smartphones. And when we look at the people that we serve in rural, they don't have those means. So how are we making sure that this current situation is not reinforcing the gaps that are already existing? So as a community organization, I think that's what we are that we need to focus on. Another role I would say is to make sure that we advocate for minority rights, because we are closer to the people. We know those one who are suffering without a voice. So that's why as community based organizations, we first need to educate ourselves to understand the better those issues or the rights of those minority groups, and really make sure that we advocate. We make sure that the other key actors, the donors, the government officials understand the issues that they are facing. So I would also say one of the other roles that we need to play is to make sure that we look at the gaps that is created by the how can I say the socioeconomic status. Because when we look at for example, at the access of contraceptives, that's an example, they are still very expensive. It's not affordable for some of the groups that we serve in the communities. So as a community-based organization, we need to continue advocating for that cause, making sure that the people in rural or the poor people are being facilitated to have access to the health services. Or maybe to be more concrete, when we look as women, as young girls, when we look at the cost of the emergency contraceptive, it's almost impossible for a young girl of a woman or a woman in rural to afford it. So all those, how can you say, all those issues, I feel as a community-based organization, I'm at better position to really understand how those issues can be resolved. And it's our role to do advocacy and making sure that we collaborate with other key actors to address the issues. Of course, I can't finish sharing what I think as a key role of community-based organization without talking about the barriers of the community-based organization in order to play that role that we expect them to play. Because when we look at those grassroots organizations, they really, really lack the resources. There is limited funds, and yet we are all expecting them to play a big role because they are there. They live with the groups that we all want to serve, but yet when it gets to funding or to capacity building, they are really there is that gap. There is a need. So I just want us to also reflect as we talk to different peoples that have influence or that are willing to invest, to make sure that those community-based organizations are well equipped to play that role that we need to see them playing. Maybe one quick comment on the question. As also community-based organizations, I think our role is also doing monitoring and holding services providers accountable, because those people we serve are vulnerable in so many ways, and sometimes the services that they deserve are not given as it should. And as community-based organizations, I feel we have responsibility to make sure that we hold those services providers accountable, so that the people we serve are being given those services in the right way. So, yeah, I think those are the key roles that I would want to share.
Yeah, and thank you so much for articulating so clearly how, CBOs ultimately are the voice of, people who don't have power or influence. You're a very important actor. And you mentioned the critical role that the CBOs play in making sure that information is cascaded down to the relevant people. And I think this speaks a little bit to what Blandine does, which is storytelling. And so my next question is directed to you, Blandine. You use storytelling as a tool to improve reproductive and maternal health outcomes. What inspired you to use this approach?
Thank you. For us, what we saw in the beginning, it was about the lack of information about all these issues, and also the stereotypes around our cultures. Sometimes it's not about having a document saying it's this and this and this, and you give it to those girls in rural areas. There is another thing about they may be shy about like attending any like gathering about these issues, attending any gatherings where you're talking about contraceptives or anything. So for us, it's about having this information in a creative way that they can enjoy having it because they're really young. They don't want boring things about, there's a document here, you need to read. So for us, we chose this. Like, it's not just about having the information to them. It's about having it in a way that we stick to their minds, in a story that like they can remember. They can like if it's my story that I'm giving them, it's something that I went through, or if it's my friend or another person that I know. It's trying to connect them to the story, taking them to a place where that thing happened and taking them through the consequences of a certain thing. Like if they need to know this, what can happen if they don't know this, or if this happened to to a certain person, what was the cause? How could they dabble into it? So for us, it was more about like availing those information, but in a way that we easily take to the minds of these girls.
Yeah, thank you. And I think you express so clearly how much storytelling sticks more than, for example, a set of statistics. So my next question is for you, Bonita. And I'd just like to ask, what effect has eHealth had on reproductive health equity, say, over the past decade?
Thank you, Fato. I have been in the eHealth field for the last 6 to 7 years, and I can say thanks to the pandemic, in health we have been able to appreciate eHealth more as opposed to before the pandemic. Case in point, I'll use fertility. Before, people had to fly in, I think in Africa, people had to fly into countries like Uganda, Kenya, Zambia, where like the most articulated fertility centers are. But one of the things we ran a pilot during the pandemic. Basically, what we were trying to do was to examine the feasibility of using internet-based technologies for fertility-related teleconsultations in an African context. And we found that people found this as a better approach because, one, it allowed them to be able to get consultation without having to fly to the country where the expert was best. Also, people could stay anonymous, like you could have a consultation without revealing yourself. This was especially helpful for men because men also have issues with fertility, but they're a bit more shy to be seen at a fertility center because they believe everyone will know. Then it was saving people cost. Like it was way cheaper. We were charging them $100 for a consultation, which could have been more expensive had they chosen to fly into a country to book accommodation and then spend all those costs. So if you ask me the impact of eHealth, I feel like I would say that it increases access, and it also helps the people who are providing the medical services to do it in a more efficient and effective manner. Because if people are going to have to come to your office and line up, you might end up seeing 10 people. Yet if you're going to if you're going to see people on a digital platform, you might be able to see more people as opposed to when you're seeing people in person. Also, it was like using eHealth allows participants or allows people seeking medical care to be able to provide their medical history and articulate their needs. How? For example, usually when you're filling a form to be able to access to have an appointment digitally, they will usually ask you a few questions. So by the time you walk in to see your doctor, they already have your information. And also, like, it's just a minute. I have a little Aniambani. Please go away. Sorry. So over the past decade, if you ask me, eHealth has been very important. One, people are able to access the services incognito. Young girls are able to ask about family planning methods without having to go into a medical facility. In Uganda, we currently have Rocket Health, which was formerly the Medical Concierge Group. It's more of WhatsApp a doctor. So you're able to get access, you're able to get services without really having to walk to the medical facility. This saves you time, this saves you time spent in traffic, time spent on fuel, and also time spent just waiting for the doctor. So at the moment they have advanced to, they can be able to deliver all these services to your home. They can come to your home. If they can come to your home, deliver condoms. They can come to your home, deliver some of those jabs. Right now they're even testing for COVID and stuff like that. So in the next, for the past 10 years, like 5 years ago, Ehealth was a myth of some sort, at least in my country, Uganda. It was a brilliant idea, but given the challenges with internet connectivity and the like, it wasn't something that people thought could be easily achieved. 5 years later, I mean, we no longer have to go. Personally, I can have my antenatal in my home without really having to walk to a health facility. And I think that just the facts, the comfort of knowing that I don't have to queue up to get COVID, to go through the traffic and everything. For me, I think that's a very big issue. But especially in the fertility center, we have seen more people come out to access services, especially men, as opposed to when they have to walk into the facility itself. Thank you very much.
That's a very astute observation. So would you say that to a large extent, Ehealth is almost inadvertently destigmatizing reproductive health access?
I would say yes. Why? During the pilot we did, we were asking people if they had ever accessed fertility services. Most of the men said no. And when asked why, they cited stigma because they didn't want to be seen at a fertility center. So yet it was easier for them because part of the options we had is you could decide to consult without revealing your identity. So actually we had more men booking for consultations who had never been able to be confident to ask for consultation to solve their problems. Also, I also think, like, one, it's more affordable as opposed to walking into. Okay, let's just break it down to a simple way. You just need to walk to your facility. You need to have fuel or transport. You need to have the time to go there. You need to have the time to wait. But if it's Ehealth, you're going to just sit at the comfort of your home, book an appointment. So at the scheduled time, you're going to access that. And then I feel like also Ehealth is very fundamental in literacy. For example, before these people have the consultations, you give them simple materials to tell them what infertility is really about, and to give them this basic information and some of the services they can access. So, for example, a lot of ladies did not know about egg freezing as a service, as a fertility service. And when we gave them some of this material, they're like, oh, so I can freeze my eggs up to a time when when I really want to have my kids. So those are the literacy. I think Ehealth is very fundamental in literacy. It's more affordable, just that the initial setup costs are a bit high, but in the long run towards the end user, it's more affordable. It allows people to get services without being shy or without having to be seen. So I think at a very high percentage, it destigmatizes access to reproductive health services.
Thank you, Bonita. You mentioned a key issue of literacy. And so I'm going to circle back to you, Solange, because I know that you do a lot of work related to literacy, increasing literacy or improving literacy outcomes in your grassroots. And so my question is, the World Health Organization has identified education as an upstream determinant of reproductive health. How have education outcomes for girls changed in the past 5 years, in your context? You're muted.
Sorry. I was saying that's a big question, but an interesting one. But of course, there are a lot of studies that have been done that shows the linkage between education and the better outcomes in terms of reproductive health. That's a fact, and we have seen some of the good outcomes from that, because when we look at the educated girls, we see confidence in them in making informed decisions when it comes to, for example, to the use of contraceptives. And for instance, when we look in Rwanda, there has been a huge increase in the use of contraceptive. I think in the last decade, we have gone from 17% to 53%. And a lot of that can be attributed to the fact that more girls and women are educated and feel equipped to make decisions over their bodies and making informed decisions when it comes to reproductive health. So another good outcome that I may share is in relation to seeing more girls achieving higher education or pursuing education, because we all know when women are educated, they are more likely to send both their boys and girls to school. And the longer we stay in school, the better outcomes, less unwanted pregnancies, less, how can I say, the infections, like HIV. So we have seen the impact of investing in girls' education. For example, in Rwanda, I think in 2008, we have our government have started the community-based initiatives, the community-based schools, which is called 12-year basic education, because we are promoting education for all. And we have seen the impact of having all girls and boys from vulnerable families being able to access school. So I might say that, of course, it's a journey, but so far, education has really impacted the reproductive health in, at least in our country, as I shared. And of course, we all know the more girls and women that we get out of illiteracy, the better income they generate. So we have seen some women that started businesses, that some young girls like Blandine, who are advocating for issues that young people are facing. And those young organizations, that are being led by youth, are more radical. You know, they are willing, they are open to challenge and to, you know, discuss about the issues that otherwise other more traditional and well-established organization wouldn't want or even know how to tackle those issues. So to me, the link between education and reproductive health has been really apparent, and it's playing a big role in that.
Yeah, and that's such an important association to make. And just to digress a little, based on the losses that we've experienced in education outcomes due to COVID, what are your concerns about this association between education outcomes as well as and reproductive health equity?
Oh, yeah. There are a lot that we need to reflect on and to really act upon, because education is one of the sectors that COVID-19 has really greatly impacted. And I was reading some of the articles written by UNICEF, expecting really big number of girls who may drop out of school because of the effect of COVID-19. So to me, as the civil society organizations or government or private sector, I think our role is to make sure that we don't, how can I say, missed the word. We make sure that we don't lose the progress that we have made. Because if we are not being intentional to address the effect, the issues that girls are facing in this situation, we are more likely to see the decline in progress of girls' education, which is ultimately impact the reproductive health. So that's why we really we are inviting all different actors, donors, or influencers, government officials, to make sure that we are there to support girls and in post-COVID, and make sure that they feel supported enough to want to continue their studies. Otherwise, we may face inequalities in so many aspects. Yeah.
Great. Thank you so much, Solange. And as we wrap up, I'd just like to thank you all three for the contributions that you have made. It has been such an honor to be able to share insights and thoughts with you today. And I also want to thank the audience for listening. And I hope that this discussion has been fruitful to you all. So thank you and goodbye.
Thank you so much.
Goodbye.
Bye.